Welcome to Medical Marijuana and Wellness. Tonight's topic is Understanding Medical Marijuana Use, Part 1, and we'll be talking about tinctures. Before I jump into this webinar, let me cover a couple of housekeeping issues. First of all, if you have any questions, please feel free to hit the Q&A button at the bottom of your screen. We're here to answer your questions, which we'll do at the end of this particular presentation, and also we'll answer any questions that you submitted prior to the webinar at that time as well. Also, as a follow-up to this particular webinar, you'll get an email that will give you a recording of the webinar, copy of the presentation in flipbook format, sponsor discounts, and other important information. So please check out our YouTube channel, marijuanaaware.com, for not only this video, but other videos from our series. Also check out Marijuana Aware, where you can sign up for future webinars. So let's talk about routes of administration, sometimes called methods of consumption. This is the way medical cannabis products are consumed, and it's the paths by which substances enter your body. Routes are usually classified by the substance or where the substance is applied, absorbed, or where the target action is. The basic categories for medical marijuana products are sublingual, oral, inhalation, and topical. So how do you choose the right route of administration? Well, first of all, you should consider the onset time. How long does it take before you begin feeling the effects of the product? Duration. How long can you expect for the effects of the product to last? Ease of titration. That's the ability to adjust your own dose in small amounts. And also the availability of the entourage effect. The entourage effect is a unique feature of cannabis where the individual components, the cannabinoids, terpenes, and flavonoids are medically enhanced when taken together. Also, you may want to consider any hardware or material that you need to be able to consume the product. On the right, you'll see most of the common routes of administration, along with the way they're absorbed in the body, the onset, and the duration time. For example, you can compare the routes of administration based on their onset and duration. Now, onset and duration are typically a trade-off. The faster something works, the faster it will leave your body. The longer it takes for something to work, the longer it will stay in your system. Tinctures come in a bottle with an eyedropper to measure the dose. Tinctures coat the mucous membrane beneath your tongue, the inner walls of your cheeks, and along your gums. So how do you take it? Well, place the tincture liquid in the eyedropper and place that under your tongue and hold it for a moment. Swish it around your mouth, and it should absorb into your mouth within about 30 seconds. If not, swallow the remaining tincture. Remember that what you're swallowing is going to be absorbed by your digestive system and not by the mucous membranes on the inside of your mouth. Tinctures that are absorbed through the mucous membrane on average take about 15 to 20 minutes to feel the initial effects and approximately 30 minutes to an hour to feel the full effects. The tinctures that you swallow are absorbed into your digestive system. That'll normally take 30 minutes to 2 hours to be able to see the initial effects, and also the full effects will take approximately 2 hours to 3 hours. Now keep in mind, there's an interesting tip that Nurse Amy, who co-hosts some of these webinars with me, has for people with mobility or arthritis, and that is to take the tincture liquid from the eyedropper, place it in a spoon. With that spoon, you can actually take the tincture liquid and place it either under your tongue and or swallow it, depending on what's comfortable for you. Tinctures make titration very easy. This is the ability to adjust your dosing up and down in small amounts. Now, this is especially important for first-time medical cannabis patients who may not know their tolerance to medical cannabis. Tinctures are easy to use, but may require just a bit of math and also some trial and error for you to be able to find out what your sweet spot is. Now, what are we talking about here? Well, if you look at the liquid that's in your bottle, that's measured in what they call milliliters. The quantity of cannabis listed in the bottle is milligrams. So if you have a 1-to-1 tincture product, which is equal parts of THC and CBD, so let's say the volume in the bottle is listed as 30 milliliters, and the content is listed as 150 milligrams. That would be 150 milligrams each, THC and CBD. So dividing 150 milligrams into 30 results in 5 milligrams per 1 milliliter. Now, the entire eyedropper up to the line is 1 milliliter. A 1-to-1 tincture is equal parts of THC and CBD. So what that means is you have a 1 milliliter eyedropper, you have 5 milligrams of THC and 5 milligrams of CBD. Now, if you're looking at finding out what your sweet spot is, I recommend that you go low and start slow. So what that means is start with about a quarter of an eyedropper. That means 1.25 milligrams of CBD and 1.25 milligrams of THC. Use that for a day or two and see what the desired effects are. If you're not getting the results you want, up that dosage to a half an eyedropper, which is 2.5 milligrams of CBD and THC. Again, try that for a day or two and continue to increase the amount in the eyedropper until you achieve the level of relief that you're seeking. So the bottom line is that tinctures are not only easy to use, but comes with all the required material you need to be able to use it. There's a bottle of tincture oil, which is the medication, and the eyedropper is right in the cap. Now, as a usage tip, it's recommended that when you're going to use, or you're going to titrate with cannabis, especially medical cannabis, treat yourself to a little snack or a drink with fat in it, like coffee with cream, or a spoonful of peanut. Cannabis loves fatty acids. And as mentioned earlier, Amy Green also recommends potentially using a spoon if you have mobility issues. So let's review the pros and the cons of tinctures. Pros. It's relatively fast-acting onset time. It's not as fast as inhalation or topicals, but it beats edibles and capsules by a mile. Very easy to make a dosing adjustment. What that does is it makes it very cost-effective for you to control the amount of tinctures that you're taking via the eye drop. Contrast that to something like a capsule, that if you take that capsule and it's too strong, there's not much you can do about it. Tinctures, like gummies, are something where you can take a half, quarter, and you can titrate up, titrate down, again, depending on your need and your tolerance to medical cannabis. One of the keys to tinctures is that you don't have to add heat to use it, which means none of the terpenes will be burnt off. And also, the cannabis components listed on the bottle or the COA will be the ones that you put into your system. Whereas when you're vaping or you're smoking, they can convert some of those cannabinoids into other cannabinoids, or they can be burnt off. And typically, tinctures are non-psychotropic, which is a big pro, which means you can microdose them during the day, still stay functional while you work. Patients whose objective is to use medical cannabis to get high will find that there are probably better routes of administration to use. All that being said, tinctures are easy to use and a great way to use medical cannabis. Thank you for